LMS, Health Obstetrics and Gynecology. I always have to say it quite slowly so that I don't twist my tongue. Doc, good to see you. Good morning.
Good morning.
I hope you're doing well.
Yes, I'm well indeed. Thanks for having me.
Today we have a big topic on the table. Some might say quite sensitive when you talk about age, talk about childbirth, talk about PCOS. Let's just set the stage. When we talk about PCOS, what are we talking about?
PCOS stands for polycystic ovarian syndrome. Polycystic ovarian syndrome. And the description came about because people who had this condition tended to have multiple ovarian follicles when you do a scan. You see several round black circles on their ovary. So normally you'd see maybe 2 or 3 or 4, but they would have 20.
Okay. Now on the ovaries.
On the ovary.
Okay.
So the ovary contains follicles. The follicles are the eggs, where the eggs grow from. The follicle busts to release the eggs. And every month you're supposed to grow one follicle to become mature, and that follicle busts and release the eggs. With people who have PCOS, the follicle grows a little bit and then stops growing. And then next month, another one grows a little bit and stops growing. So they don't complete the process. They don't release the eggs. And that's why we say they tend not to ovulate. And because of that, you have plenty eggs that have come from baby eggs to teenage eggs, and then they stopped at teenage, or baby follicles to teenage follicles, and they stopped growing further to become adults that would get married and leave the house. So it's like you've got 20 elder sisters in the house, nobody's getting married, and you can't get married because you're the junior one. That's the kind of the way the ovary looks like. But there are other parts to it, and that's why it's a syndrome. So the other part to it is that they tend to have hormonal abnormalities that tend to cause them not to have regular menses, or to release their eggs. And then the other part is that they tend to have excess male hormones. So the male hormones either manifesting by excess hormones in the blood, or they are very hairy, or they've got a lot of acne, or they've got oily skin, things of that sort. So all those combined together is what we describe as polycystic ovarian syndrome.
And when we talk about symptoms, what are the symptoms of PCOS?
For most women, all they realize is that their periods are not regular. So the period comes every 2 months, every 3 months. Sometimes for 6 months it doesn't come. And then when it comes, they bleed for several weeks. Sometimes a whole month they are bleeding. And it can be painful, but tends to be prolonged most of the time. So that is what they would notice. Or they are trying to get pregnant and they've not been successful in getting that, I've got this acne that is not going, and I've used all kinds of medications and it's not going, and that is why they come. But the majority of people, they have the acne problem, they don't come. They have the irregular menses, they don't come.
Right.
They have excess hair, they don't come. But when they fail to get pregnant, then they come to the hospital and say, I have a problem, I'm not getting pregnant. And then when we investigate, we find these things behind it.
Should any one of these symptoms that you've mentioned be a cause for concern, or does it have to be a combination of these symptoms?
The patient may notice usually one of them, not necessarily the combination. You may notice one. When we do the assessment, we see the other things that come together and gives us a diagnosis. Because some people are hairy. They are just hairy.
That's right.
But if she's hairy and she's having children and everything is going okay, she may not come to the hospital because it's not bothering her. But if she realizes that, no, I'm getting hair in places that I don't think I should be getting hair, yes, she can come and if an assessment to be done, and then we'll find out whether it is a pure hair problem or in actual fact this is part of a syndrome. So there's some image of a woman on the internet called the bearded woman. There are videos about, she has PCOS. So she's like the extreme hairy.
Right.
But for most people, it's just a little bit of hair on the upper lip or on the chin.
And usually they'll tell you, as you age as a woman, you'll find maybe 1 or 2 hairs on your chin, a bit of a mustache. It's not anything to be alarmed about. But is it something that you would say,
if you are younger, definitely. If you're older and it wasn't there before, we may say it's due to something else. But definitely, it's not bad for it to be checked out.
How is PCOS typically diagnosed in a clinical setting?
We look for menstrual abnormalities. We look for signs of excess male hormone, and we look for abnormality of the ovarian morphology on ultrasound. So we do a scan to look for the cyst on the ovary, like a very, very small balloon.
I see.
They're 2 totally different things. The golf ball is harder. It's more rigid. It gives if you can't just squeeze it like that. While the cysts are just very, very small balloons that are on the ovary, and they're in two different locations.
Okay.
Ovary, uterus.
The
Fibroid is in the uterus mainly, and the cysts are in the
ovaries
mainly.
Right.
That doesn't mean you can have a cyst in the uterus. There are circumstances that can give you a cystic mass. Let me not say a cystic mass.
Okay.
In the uterus, yeah.
Now, are there variations of PCOS that affect women differently?
I've mentioned 3 main criteria, but in actual fact, you can have only 2 of them. Some people have only 2. So some people would have the abnormal menses, and then they would have the excess male hormone, but their ovaries, when you do the scan, does not look pretty bad. If you count the follicles, you won't get a number that will qualify for it. Some other people would have the ovaries looking abnormal and excess male hormone manifestations, but their periods are coming regularly. And then some people have all 3. All 3 parameters. So it affects the treatment a little bit because what they complain of is slightly different from one person to another. If somebody came and they said their problem was mainly the hair, the treatment may be different from somebody who's trying to have a baby.
Interesting. Yeah. Now, speaking of babies, how exactly does PCOS delay childbirth, or how exactly does it make childbirth difficult? Or shall I say conceiving difficult?
Yes. To have a baby, you need to have good egg, good sperm, good tube, good lining of the uterus.
Okay.
So a good room for the baby to sit inside. So if there's something sitting inside the uterine cavity, polyp, fibroid, adhesions, it's difficult for you to get pregnant. If the sperm is bad, it's difficult to get pregnant, and the sperm accounts for half the problems that we have, despite what people may think.
And always it seems as though the men kind of go scot-free when it comes to issues of infertility. But that's a topic for a whole different day.
Different,
but sperm quality, obviously, a big part of the equation.
It's a big part of it. If your tube is blocked, that is part of the.
They've missed the date.
So assuming that you ovulate 4 times a year in this woman, and you manage to quarrel with your husband on those four times in a year that you could have gotten pregnant, all the rest of the year you wasted your time.
Oh my goodness!
For trying to in your attempts to get pregnant. So that is a problem enough in itself. Then the hormonal picture gives you a very hostile environment. So in the event that you do get pregnant, people with PCOS tend not to release a particular hormone that supports the pregnancy. So what happens? The pregnancy does not stay. So they tend to lose pregnancies between first month to the 3rd month.
Okay, so that is sort of before the 12-week month.
Before the 12-week month, they lose pregnancies a lot. And that is because of the hormonal problems that they have. Then after the past 12 weeks, they have another problem. They tend to lose pregnancies because the uterus is unable to carry. So they also have another batch for the 2nd trimester.
What is the terminology for that, for when the uterus is not so supportive?
For what we describe it as cervical incompetence. As the cervix is not competent enough to hold the pregnancy inside.
And that's what you hear sometimes. They say, well, this lady is put on bed rest and her legs are sort of suspended.
Yeah, actually, it's the bottom you're trying to suspend. But
okay. So, I mean, that actually happens.
Yes.
I see.
Yes, the objective of suspending is to reduce the weight, the pressure on the cervix, which is weak.
Okay.
And that is why we put a stitch inside. That's why they give you all kinds of medication just to protect it. So PCOS people tend to have those problems as well. So if a woman comes and she tends to lose her pregnancy around 4 months, 5 months, we have to explore that area.
Interesting.
Because it is also a potential cause of that.
What are the most effective medical or lifestyle interventions for managing PCOS symptoms?
The first thing we must remember that it is not a fertility problem. It is a hormonal problem. It is a metabolic problem. A hormonal problem or a metabolic problem means the problem you have is for life. Whatever gap there is, you were born with it. So it's not something that you take paracetamol and it goes like a headache. You don't just take medicine for patients complain, I'm taking the medicine for too long. You have a lifelong problem that we are trying to address.
Right.
And if you address the lifelong problem, everything gets better. The problem with PCOS is that if you have PCOS, you have increased risk of diabetes. In 20, 30 years' time, you'll be diabetic for most people. If you have PCOS, you're likely to become hypertensive. If you have PCOS, you're likely to have lipid abnormalities. If you have PCOS, you are even likely to have increased risk of having depression. if you have PCOS, you have the increased risk of having a heart attack. All these are because it is a metabolic problem and not necessarily a fertility problem. So treating it is better for your long-term health, not just because you're trying to have children. It also means that the solution is not just medication. It starts from lifestyle changes. Based on the test that we would run, we would know if you are the type that has got high insulin resistance or not. If you've got high insulin resistance, we have to to change that situation. If you've got hormonal imbalances, we have to correct those hormonal imbalances. If you need to lose weight, you need to lose weight.
Right.
All those things will put you on the path to correcting your situation. Then we say, oh, what are you trying to do? You just want regular periods, we give you medicine A.
Okay.
Do you want to have a baby? We give you medicine B. Do you not want to have your periods at all? We give you medicine C.
I see.
We can do all kinds of things, but all depends on what your objective is. But that does not stop the fact that we need to work on the cause, should we say, the basis of the disease process.
Would you say that there are preventative measures that can be taken to avoid PCOS?
If you've inherited a gene, you've inherited a gene. However, if you lead the appropriate lifestyles where you don't put stresses on your system. So for some people, they are not able to metabolize carbohydrate well, for example. If you give them a lower carbohydrate load, automatically you've put less stress on the system's weakened ability to manage. Therefore, the consequences will be less severe. So there are things you can do. I mean, all of us need to consume less sugar. All of us, myself included.
Certainly.
All of us need to consider the amount of carbohydrates we take. My grandfather was a farmer, so he needed to eat large portions of carbohydrates because of the work that he did. He burnt that energy. I move a pen most of the time. That is, my weightlifting is a pen.
But you look to be in good shape, Doc.
That's my father's genes.
Okay, you're lucky.
Yes, indeed. So I don't need that amount of energy in my diet to allow me to live. However, if I grew up eating like the way my grandfather did, which is how we tend to do, that's how we grew up, we consume that amount of excess carbohydrates that we don't need. And if you don't have the ability to metabolize it well, you would have issues that will eventually result in this condition.
Certainly. And I understand this is PCOS Awareness Month, the month of September. And so we'll be having more of these conversations. They say time flies when you're having fun. But Doc, I think we've been able to explore at least the fundamentals of what a lot of our listeners were anticipating that we do. Maybe we can schedule a part 2 to really get into the nitty-gritty. Maybe also get some intervention, some help for or answer some of the burning questions and address some of the myths and misconceptions. But Doc, very grateful for your time this morning. And Dr. Paddy Ayete is a medical director, LMS Health Obstetrics and Gynecology. LMS Health Obstetrics in Accra.
Yes.
Okay, whereabouts are you located?
We've got 2 locations. We've got a location on the Volta Street at Airport Residential Area. It's an office practice. And then we have the main hospital and wards at Community 18. Off the Spintex Road, Community 18.
And so for our burning PCOS questions, we can certainly contact LMS Health Obstetrics and Gynecology for that support.
Yes,
thank you so much for your time this morning, and I'm sure we'll be speaking again in due course.
It's been a pleasure. Thank you very much for having me.
On my part as well. Time check, it is some 4 minutes to the top of the hour. Only 4 minutes to go, and we're bidding you farewell. If it's your birthday today, we're wishing you a happy birthday.